And I call Jamie Green.
Can I thank you, Deputy Presiding Officer? Can I ask the Scottish Government what it is doing to reduce deaths in custody in light of new statistics showing that a record number of people have died in prisons in the past 3 years?
Cabinet Secretary Keith Brown.
First and foremost, my thoughts are with everyone who's lost a loved one in prison custody. The safety and well-being of people who are in prison is a priority, and we recognise that we need to do more to support positive health outcomes for vulnerable people in prisons. The Prison Health and Social Care Needs Assessment, which we published in September, and the work undertaken in response to the Independent Deaths in Custody Review are key steps in our commitment to achieving that aim. All frontline staff are trained in the Scottish Prison Service's Prevention of Suicide strategy, which provides a person-centred care pathway for prisoners who are at risk of suicide and promotes a supportive environment in which people can ask for help. Individuals are screened on their arrival at prison. When needed, the SPS and the National Health Service work together to support vulnerable individuals and review them regularly. We're also working with partners and bereaved families to implement the recommendations from the Death in Prison Custody Review.
Jamie Green.
Can I thank the Cabinet Secretary for that answer? And we too pass our thoughts and condolences to all families affected by this, all 121 of them since 2020. These figures are significantly worse in Scotland than they are in other parts of the UK. In Scotland, 15% of prison inmates have long-term mental health problems, 30% of them have alcohol use disorder, and 17% actually have a history of self-harm. Yet despite all these challenges, there continues to be huge variation in the provision of mental health nurses within the prison estate. For example, in HMP Barlinnie, it's just one nurse per 282 inmates. I raised this disturbing trend explicitly with the First Minister in October of this year. So, with these deaths in custody at this tragic new high, can I ask what further progress has been made on the First Minister's own pledge to improve conditions and reduce these needless and avoidable deaths?
Cabinet Secretary.
First of all, can I acknowledge the point that Jamie Green makes about the difference in Scotland to the rest of the UK? I think it's a relevant factor to look at. I think it is more complex than is sometimes suggested. But of course, we would point to the fact that whether it's through COVID deaths or the impact of COVID itself on the mental health of prisoners, there are particular things which have made this period more difficult. However, that's also true, of course, in England and Wales. So I acknowledge the fact there's a difference here which we have to interrogate. And for that reason, I think we have to take some time to look at all the elements of the report. And for example, if you look at the way that the Ministry of Justice reports their deaths, is significantly different. So collating suicides and deaths, for example, including drug overdoses in the category of self-inflicted deaths in 2021, 86 deaths were self-inflicted in England and Wales, which is an increase of 28% from the previous year. However, we do want to get to the bottom of the fact that in Scotland, under the latest figures, which go back now to 2018 from the Council of Europe, we are up at 47.6 deaths for 10,000, whereas in England and Wales it's 39.5. So it's a legitimate difference. We are engaging with NHS, SPS and prison care networks to embed the medication-assisted treatment standards in prison settings. There's additional support being provided for the provision of health services, although it is an ongoing issue. And of course, there's also been an impact through what we've heard in the previous set of questions in terms of staff difficulties, locating new staff for the health service. That also has an impact on prison as well. But I'm happy to keep Jamie Green updated as we go forward.
Jamie